This Medical Minute, sponsored by Avera.
In tonight's Avera Medical Minute, we're taking a look at men's health. And the very first step for a man to take care of his well-being should involve an annual checkup. But those checkups aren't happening as often as Dr. Dimitris Skirlis would like to see. Dr. Skirlis, is it kind of a myth that guys wait to go to the doctor, or is that a real thing?
Yeah, typically men do wait longer to go see the provider. It's unfortunate, but regardless of ethnicity or income, it is what it is. They don't come to the doctor as often as they should. In fact, men are 2 times more likely to wait 2 years between their appointments and 40% more likely not to come to see us until symptoms have progressed. And at that time, it might be a little behind the 8 ball.
Is there a period of time where a guy can just wait and see what's happening, or at the first sign that something might be different, should they get in?
Yeah, that's an excellent question. And here's the answer to that. You know, many diseases don't have symptoms initially until the symptoms or the disease has progressed. And by that time, you know, early prevention we're past that time. So early detection is key. So if you're having symptoms, don't delay, go in right away.
What are the things that guys should be thinking about and worried about in terms of illness? I mean, I know that there's an age gradient for some things, but what should they be keeping an eye out for and be worried about?
Well, if you have any new symptoms, you should go in to be seen. And having an annual health screen gives you at least some peace of mind that something isn't going to sneak up on you. So an ounce of prevention is worth a pound of cure. So even if you're feeling healthy, go in, get assessed, get checked. At least you can validate your health and identify any problem before it gets out of hand.
I imagine that you're worried about heart conditions and various sorts of cancers that guys might not be thinking about, but they should be.
Yes, absolutely. So meeting with your primary provider who knows you and your history and your family history is important, because then they can address or look for any concerns you might have based on your age. Colon screening, colonoscopy is the gold standard for colon cancer, because colon cancer is the #3 most common cancer in the United States and the #3 cause of mortality. So colon cancer screening would be recommended between the ages of 45 and 75, because we're finding colon cancer occurring more frequently in the younger individuals as well. So early detection is key. Prostate cancer is the most common cancer in men in the United States, but it's also the #2 killer of men in the United States as far as cancers go. And screening for that would be between the ages of 55 and 69. And again, this is something you should discuss with your primary care provider to see if PSA is right for you, and what potential side effects are there with future diagnostic modalities if in fact it is positive.
For more information, head over to avera.org/medicalminute, and we'll be right back.